Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.
Hello again, everyone. Thanks very much for joining us. A legislative session that gets more conservative with every passing day, more conservative than a conservative governor might prefer. We'll get to that in a few minutes with Cook and Vickery. First, a solemn anniversary. It's been a year since COVID-19 was diagnosed in our state. The patient at Pine Bluff would recover, but in the months that followed, more than 300,000 of his fellow Arkansans, more than 10% of the state's population, would contract the disease, and more than 5,000 of them would not recover. The coronavirus claimed not only lives but livelihoods, and almost certainly would have done more economic damage without federal relief efforts. It became the longest and sternest test of the administration of Governor Asa Hutchinson, with whom we spoke earlier this week. We are at the one-year point, anyway, the first anniversary of the arrival, or the diagnoses, anyway, of COVID in Arkansas. Some 330,000 of our fellow Arkansans have been diagnosed, and 5,400, we're approaching 5,400 deaths anyway. Could we have done better?
Well, there'll be a time to assess how we have performed, and I have no doubt that there will be things that we look at and say maybe we could have adjusted that some, but by and large, I think that it's been an incredibly difficult year. Arkansans have responded well. I think we have made good decisions in trying to have a balance between making sure that we have regard for public health and saving lives, but at the same time recognizing that we have to have food deliveries, we have to have critical work being done, and we just can't shut down the economy as some states did. So I'm very proud of Arkansas as to how they've handled this. They've responded by wearing masks, by adopting guidelines to make sure that people are protected, but at the same time, it's such a tragedy whenever you look at the lives that have been lost, and I've lost a number of my friends or people that I cared about as well. So it touched every life in Arkansas.
Well, to be fair, you have caught it. Your administration has caught it from both sides, right and left. And from the left, it was that your administration, in dealing with the pandemic in Arkansas, chose the economy over epidemiology, or put more weight on the economy than you did epidemiology. Your response to that, sir?
Well, I do get criticism from both sides. If we lift restrictions, I get criticized from those that believe we ought to just shut it down. If I put on restrictions, then I get hit from those that believe we've got to open it up and that government shouldn't be that oppressive. And so you have to listen to the epidemiologist, you have to understand the disease and how it's transmitted, but you also have to balance it, and that's my job as governor, with the need of people to go to school, the need of people to get their groceries, and the importance even of sports in our society for our young people. So we've tried to do the education. We've put in restrictions and mandates where needed, but I'm glad we're to the point, because vaccines are getting out, that we can relax some of those standards, rely upon people's good judgment and the fact that vaccines are being distributed to our most vulnerable, and hopefully we'll see the day when we can get it to everyone.
In your executive order, sir, in terms of designating certain professions as critical work, was it too broad? For example, hospitality and retail. Was your definition of critical work too broad?
Well, we tried to follow the CDC guidelines. That's the starting point. And so we listened to those national experts, and really ethics plays a role in it as well. And then we adjusted as we need to fit Arkansas. For example, we moved it down to age 65 because that picks up those that have had higher death rates, that have comorbidities, underlying conditions. In terms of the critical workers, you have to first get those covered that are in essential industries, providing electricity for us. Manufacturing is critical. Food service is critical. And then when it comes to government workers, you have to make a distinction between those that are on the front lines that are dealing with the public versus those that can wait a little bit longer to get the vaccine. So we listen to our epidemiologists, but also trying to keep the supply line full. We want the demand to increase. We want to make sure there's more people asking for the vaccine than even what we have available, because we want to keep we don't want to have any lax or slack in getting the vaccine out. We want that demand to be high, and that's why we raised it this last week.
Your restrictions, sir, your executive orders in your judgment were appropriate and not excessive, and you say that Arkansans have responded well in the past year. Yet still, we remain among the top tier of states in both case rate per capita and fatalities per capita, morbidity. Why, sir?
Well, I think if you look across the South, you have underlying health conditions as part of it, and so you can't compare necessarily where we are in Arkansas with a North Dakota or a Massachusetts necessarily. So there's a lot of differences between the states, and also I think you'll see as we go through the review of this over time that there's a lot of different statistical variations on how you count some of these. We've done a very good job in Arkansas, but it is something that's going to be looked at as to why we've had the deaths that we've had. Is it because of the underlying health conditions, or is it because of other steps that we may or may not have taken? As I look back on it, I think that we did the right judgments. We put public health measures in place. We put restrictions on businesses. We educated the public. We put a mask restriction in place. We put our workers and vaccination priority in our long-term care facilities first. And so we've done all the right steps to preserve life. No, we did not shelter in place, but we had restrictions in place that would minimize the spread and hopefully have the measures in place that would reduce the number of cases. And while we haven't been 100% successful in that, I do believe we've maintained the right balance, and that we trusted people to make good judgments, balancing that with the restrictions we put in place.
Some of those restrictions, sir, by your directive are going to wind down at the end of the month. Perhaps you have reserved the right to renew them. But there have been warnings from health experts here in Arkansas as well as nationally that we are running the risk, well, to quote Dr. Fauci, a fourth wave. Are you concerned? How concerned about that are you, sir?
Well, I listen, I hear those concerns. Someone said we're going to have a fourth wave. As you mentioned, Dr. Fauci, others say that we're in the eye of the hurricane, that it's calm now, the cases are going to come back. I don't know whether that's going to happen or not, but you have to be prepared in the event the cases do go up, and that's why the emergency is still in place. That is why I didn't have a cliff, that we immediately ended our mandates and our restrictions and our mask mandate. We kept that in place for 30 days to see how the cases will go. Our emergency will continue in place as needed. If we have to put additional protective measures in place, we will. But I'm hopeful with the increase of the vaccine going out, with the education of the public and the decisions that they make, that we can continue this path of moving back toward a more normal life. People today know exactly what they need to do. If they are in a vulnerable position, if they need to stay 6 feet away from people, not have that close contact, if there's a restaurant that's not following good guidelines and health practices, don't go there. People can make good judgments to protect their health. We've been in this a year, and at some point you have to say, We have got to move from mandates to public common sense, and that's the direction we're going.
Are we moving that vaccine fast enough, Your Honor, to our governor? Are we moving that vaccine fast enough into Arkansans' arms? We hear reports of leftover quantities, or unused quantities, I should say, of vaccine at the end of a particular day. Can we make that process more efficient?
We're working on it every day to make it more efficient. We've, I think, had good success in getting, I believe it's 13 or 14% of our population that's received one dose. By the end of this month, we will have over 1 million doses that have been put into the arms of Arkansans. We do not waste any doses, and so whenever a provider runs out of people to vaccinate on the list, there to make sure it gets into the arms. Nobody's wasting any doses, and we want to continue that path. In terms of efficiency, we're balancing that with equity, trying to get it to every part of a rural state to make sure that our minority populations are covered as well. And whenever you have a limited supply, you have to set priorities. You have to organize this. So it is a logistical challenge that I'm very proud of the Department of Health and our team members that are doing a great job, from Walmart to our pharmacies that are local to our hospitals are doing a great job in getting that vaccine out as fast as we can.
Governor, your frustrations with the previous administration in Washington were transparent. You acknowledged them, I think, over the past year. Has the response, has the coordination between Washington and Little Rock, or the assistance from Washington, improved in the last, well, frankly, since January 20th?
Well, first of all, at the level that's critical, which is the staff leadership from the coronavirus task force, the medical professionals, there's been a mutual and continued commitment from the Trump administration to the Biden administration. And so the dedication is there, the urgency is there. There are some changes. The Biden administration has probably given the states a little bit less flexibility in terms of the vaccine management. They're directing a little bit more of it from the federal level, which chafes the states some because we think we're very effective in getting that out and we know our states the best. But the dialogue is consistent, it is good, and I compliment the Biden administration for using the Defense Production Act to require Merck to join in the manufacturing of a vaccine for a competing company. That's the proper.
I'm sorry, sir.
Well, it's a proper use of that, and it really has helped to accelerate production and what we're going to see in the future.
Well, in fact, sir, as we're taping this interview at mid-morning on Wednesday, the announcement from Washington that 100 million additional doses may be coming online very soon from that consortium that you just mentioned, JJ and Merck, I think. How soon?
Well, that was very.
Yeah, how soon, sir, can we expect a shipment from that cache?
They tell us every week what we are going to expect over the next 2 or 3 weeks. There's a little bit of a long-term planning information, but I think for the rest of this month, it'll be a steady flow with small increases. But whenever you get to April, I expect that's whenever it will accelerate very quickly. And that's what we have to be prepared for because we're going to finish 1B, the critical manufacturing workers and others this month. Next month, we're going to move into add another 1 million people to those that can be vaccinated. And that's when that supply is going to have to be there. And it looks like there's some promising information that could happen.
Okay, and finally, sir, you had a victory in the Senate the other day, and now your Medicaid expansion bill, the renewal anyway, is going over to the House. But those were the easy votes, simple majority. You still have an appropriation to get through at a much higher threshold in both chambers. Where do you stand?
Well, I expect that to pass, both the authorization, which is a simple majority, and the appropriation bill. Now, we got to get 3/4, so we've got to add votes to that. But this is very encouraging. Yesterday, the legislature done an outstanding job in helping to craft this new authorization to keep 300,000 Arkansans covered with good medical coverage. And so we've got more work to do, but everybody thought we'd go into this session that might crash and burn. I'm delighted with the leadership and how that's progressing, and I expect that to pass before the session ends.
And finally, this, sir, you as governor and also as a former DEA administrator and federal prosecutor, there's now legislation in the General Assembly to decriminalize what are termed small amounts of marijuana. Would the administration have a position on that?
I would oppose that. I understand medical marijuana, but to decriminalize it really sends the wrong signal to the next generation that it's not harmful, that it's okay, and it would increase usage dramatically, and I don't think that is beneficial. Right now, it is at a good place with medical, using it for medicinal purposes, and that should be good for Arkansas right now. I would oppose extending that.
Governor, you're generous with your time, and we thank you for it.
Great to be with you, Steve. Thank you.
Oh, you bet. And we'll be right back. And we're back now with Bill Vickery on the right and Michael Cook on the left. Gents, as always, thanks for coming in. We're at about halfway point in this session, and it's been an unusual session for a sitting governor. Bill.
Well, yeah, I mean, you mix in the pandemic, which that's no small order, by the way, which I think has had a profound impact on the way the legislative session has been carried out. And I believe that we're going to see some of these practices that were put in place because of the pandemic be permanent with the state legislative process. But, the governor's in his sort of final term. Traditionally, these are sessions that can become somewhat contentious between the executive branch and the legislature. But I do believe that hasn't reached the promise that was delivered on the front end to talk about the combativeness of the session. I think, given everything, there's been a pretty good working relationship between the governor's office and the state legislature.
Oh, well, tell me if I've got it right here. Part of the dynamic at work here is that the General Assembly, or at least his caucus in House and Senate conference, GOP, it's rather more conservative than he is.
Well, and I think that's a great point. I mean, I think the argument politically in Arkansas now when it comes to legislative politics is center-right versus the right. For a long time, Democrats, that's where all the action was, and you had all the policy arguments and discussions were center-left to left, and now you see that shifting. And so it's not so much sort of a real breaking of the party as much as it is just this is the way business is being done now. This is where the policy arguments are being had, and you see it all playing out in public now. But all that's really changed is we've just become more conservative, and I believe this legislature is reflective of the state that it represents.
Yeah, and Bill, or rather, excuse me, Michael, in terms of the Democratic Party, just the sheer numbers or lack of same in both chambers and ideology, there's not a lot of room for the blues to maneuver, or thus far there hasn't been.
No, right now, I mean, Bill is correct in that this is a vastly Republican-controlled legislature, so they get to set the terms of the debate and they set the terms of, frankly, what bills get passed. That's just the nature of the beast. I would agree with Bill in that so far, there's been a little sniping at the beginning of the legislature. It's kind of calmed down currently. Maybe it'll pick back up. Things get more intense toward the end of the session. But what strikes me about this session so far, and kind of talking to the issues, is that I've never seen so many social issues come before the legislature and seem to dominate the discussion, frankly, to the detriment to Arkansas, in my opinion. But that's been interesting to watch in terms of, and frankly, a lot of it is driven by these people who want to run for statewide office in 2022. Jason Rapert with his abortion bill, Senator Missy Irwin with her bill on transgender, and others. They're pushing these bills to get themselves more play in a Republican primary, and those are a lot of times dominating the discussion in the Arkansas legislature. So, I'll be interested to see what the next few weeks bring in terms of will they start getting more intense between the governor's office and the legislature, or will it kind of be relatively calm as it has been for the most part?
Well, there's no question about it. Social conservatives would appear to be, gentlemen, having a field day in this particular session.
Well, those are always the sexy issues to cover, too, by the way. Very quietly, I think you see what started out as the private option, which morphed into Arkansas Works, which has been renamed now. A very critical element to state government. That's very quietly making its way through the legislature. The social stuff, again, it's the sexy stuff to cover. It's easy. It's all front page stuff. And Michael's right in that you have a lot of strong personalities and smart people who are looking to move, say, out of the state Senate to statewide office. But they also are very convicted on those issues, and they believe in them very strongly. But at the end of the day here, there is a lot of the meat and potatoes work of government that's getting done. It just doesn't dominate, the newspaper above the fold on page one.
Well, certainly the meat and potatoes would, from the administration standpoint, would be a continuation of the Medicaid expansion, now restyled as Our Home. The governor indicates, well, he got a victory this past week in that he got it out of the Senate. But the threshold on the appropriation, of course, is rather high, or 3/4. Bill, give us the lay of the land there, your estimation.
I do think you see a lot of members, especially conservative members, that would vote against the program as is, but they are reticent to vote against an appropriation to run an entire department. And so I do think, as it stands now, the appropriation would pass, and there is a coalition of folks. And as you noted, Steve, it takes a significant majority to pass appropriation bills in Arkansas. I think it would pass. I think that that fight has been had in terms of the policy. Now it's about running government.
Michael Cook.
It's interesting. Every couple of years, they have to rebrand the Medicaid expansion from private option to Arkansas Works to AR Home. I think it's just part of it, just to give some of these conservatives to say, "Oh, I was against the private option," or "I was against Arkansas Works," but now there's this new thing. I know there's more to it than that. There are some policy details, but it's interesting that every 2 years they have to rename this very important Medicaid expansion. One thing back on social issues, though, for a moment, that there is some meat and potatoes work, but some of these social issues do have significant impact on people in the state. For example, with this new abortion bill, basically what this Republican legislature is saying, if a 15-year-old girl is raped by her father, she will now be forced to carry the child. Or if a woman is raped or sexually assaulted, she must now be required to carry her rapist's child. That's some significant change to social policy. So the reason why it is getting a lot of play.
Yeah, we need to point out the courts would have to go along with that, of course. This is subject to judicial review, and a lawsuit's already it's in the works.
Sure, but that you're exactly right, Steve. But that's the law that they passed and what they want to happen. So it impacts potentially people's lives.
There's also this, and it's a key administration objective, and that's hate crimes. And it would seem to still have a very uphill battle. Michael?
I have never thought, sadly, that this legislation would get through this legislature. All that we've seen on these social issues, there is no way a lot of these socially conservatives, Republicans, are going to vote for a piece of legislation that is going to, frankly, stop discrimination and help out members of the LGBT community. I just didn't see that happening in this legislature. So the fact that it dies, sadly, is not surprising. But I would give kudos to the people who are fighting for it, because it is needed legislation, it's important legislation. But it will not surprise me when this dies.
Bill, is there anything that Mr. Hutchinson could do, and the bill's advocates in the General Assembly, anything they can do to move this legislation?
At the moment, I don't see any way that it moves forward. I think the devil really is in the details here, with a lot of members on both the House and the Senate end. And when you begin to define what hate is and groups that are subjected to it and the element of criminal activity relative to that, it gets pretty sticky. And so I think you've got a number of very smart, focused, well-meaning legislators who do care about the details surrounding this. and are unwilling just to pass a law just so that we can color Arkansas in with a number of other states. I think that both judiciary committees, I think, are very deliberate. But at the moment, I don't see the political will there in the legislative body.
Okay, on another subject, and that's federal-state relations. Bill, we'll start with you and then go to Michael. Give Michael the last word. We had, with no Republican votes, we had a almost $2 trillion relief package. There's quite a bit in it for Arkansas, including some individual checks. Would that soften the state's Republican leanings at all?
No, I don't believe so. And I think that's why you saw the delegation oppose it en masse. It's a Christmas tree bill. It was $2 trillion, and easily $900 billion of it could have been lopped off, and we'd still get the aid that is necessary.
Yeah, Michael.
It won't change the makeup of the state, but what we're going to see, I predict, in 6 months from now, is the congressmen or the senators will be passing out the checks that came from this bill. They'll be touting the benefits of this massively needed spending bill. So just keep watching the paper for Senator Cotton or Bozeman or Congressman French Hill to be touting the benefits and how it's helping Arkansans, even though they all voted against it to a person.
Got to end it there, guys, because we're out of time. Vickery Cook and Vickery. Thanks very much, and we'll be back to you in a couple of weeks. And that's our broadcast for this hour. For this week. Thank you for joining us. As always, see you next week.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.